So our update, July 28th, 2020. We now have 1,370 cases. We report a 30th death today. Inpatient hospitalized 2, none of those are in ICU. Home, basically actively ill, 366, 972 recovered. That is a case fatality rate based on confirmed cases and confirmed deaths of 2.2%. We continue monitoring as well as monitoring with the state contract that we have some help with contact tracing with. So basically between the two of us, we're actively monitoring about 425 folks and have completed nearly 1,500. So today we have basically 68.3% recovered, 2.3% death rate, which is different than the number I just told you on the previous slide, so I apologize for that. We had some problems with this graph. 29.4% basically at home, and the 0.1% for the 2 that are in the hospital. So our hospitalizations have continued to be quite low. Ever since they started dropping at the end of April. We did get up to, I think, 4 people in the hospital at one point in time, but we've been hovering in the 1, 2, 3 range for really quite a while now, and actually had a few days where we had no hospitalizations. And these are Ingham County residents. If you were to check with McLaren or Sparrow, there probably are more COVID patients there because they do serve the region. So I'm just reporting out Ingham County resident numbers. So our cumulative case curve looks like this. We had a nice flattening here, and we've kind of been on an upward trend that we were hoping was going to flatten out again. And you'll see in a couple of graphs here that we do seem to be on yet another uptick, but sometimes they come right back down, and then that 7-day rolling average changes. So you can see the significant number of cases reported on this day. Whoops, go back, which looks like it's probably the 26th. And that really contributes to the rolling average, which we'll show you in a minute, that kind of throws everything kind of trending back up. So once we get past this one large number right here, if case counts continue to stay down, then that upward trend in the 7-day rolling average that you'll see will turn back down fairly quickly. So it really just depends on what happens moving forward. But that one number is skewing things in terms of the rolling averages right now. So this is our percent positives per day. We've been hovering down here in a fairly good low range, below 5%, really in the 2 to 3% range of tests that are positive out of all tests that are completed. So this is rather stable. And at the same time, case counts are going up. Now, remember what I said before, if this number is stable or going down and case counts are going up, sometimes that can be a matter of increased testing rather than an actual increase in transmission in the community. Because when that percent of positive tests are staying steady, then you would expect fewer cases or a leveling of cases if there weren't just more testing going on. So when more testing is going on and the percent of positive stays the same and cases go up, that usually is an indication of an increase in testing. So again, both of those graphs are things we're going to have to watch moving forward. But you can see we had this large spike that was coming back down. This was nicely trailing down until just these last few days. We are on our way back up, but that number could go back down. When we look at cases by zip code, we see basically still 48911 in the 301 to 310 range. 48823 continues increasing and getting into new ranges. So they're in the 241 to 250 range right now. And then we go to 48910, 48864, and on down from there. So on a map with numbers of cases, the shading looks kind of like this. It's kind of hard to distinguish some of these colors. The dark blue that's 301 to 310, in my eyes, is not a whole lot different than the dark blue that's 241 to 250. So I have a hard time distinguishing those. So I'm going to let my staff know that, and we're going to work on that a little bit, because I think that's hard to see the differences when you know that this 48911 is different from 48823. And it just, I'm not picking it up visually. So probably you aren't either. When we look at it by rate and calculate rates, we see 48911 still our highest rate group, followed by the East Lansing and 48910 in Lansing zip codes, as well as this out here in Okemos as well, so Meridian Township. The heat map, kind of bird's eye view, wide view, looks like this. Again, this Meridian Township, Okemos heat spot here is the Ingham Medical Facility, where we've had a number of cases, all in one address. So that's why you see that very concentrated dot right there. And then when we look in here, you know, this trend that we saw in 488911 continues. And then we're starting to get, you know, a few more spots here in 48823. Most of 48823 is fairly dispersed, but you can see that pink shading and even that lighter kind of bluish shading is starting to fill up the entire zip code of 48823. So we are currently 51% of our cases are male, 49% female. We continue to have basically double the number of cases in the 20 to 29 age group compared to the other age groups that are in that 12, 13, 14, 15% range, and then tapering off on both ends, the 0 to 9 to 10 to 19 and in the older age groups. So that's what we look like by age. Percent confirmed cases by race, 53% Caucasian, 24% African American, 10% Asian, 10% other, 3% unknown. So when we look at that by rate, we have an African American rate of 984 compared to our 337 in our Caucasian, so about 3 times, and then about double in the Asian population, what we see in our Caucasian population in terms of prevalence by rate. When we look at ethnicity of cases, so Hispanic versus not Hispanic, currently we're at 80.9% not Hispanic, 9.4% Hispanic, 9.6% unknown. Again, you put that in a rate calculation in order to see the true distribution in population in terms of prevalence. And we're at about 411 for the Hispanics, Latinos, and 559. So a slight disparity there in prevalence between the Hispanic population and the non-Hispanic or Latino population. I did take out these 8 death graphs in our previous news briefing because we hadn't had any deaths in about a month. So with the one last night, I did put this back in, or it might have been this morning. I think it was last night. So we put that back in. We are currently with 43.3% of our deaths are over the age of 80, 13.3% 50 to 59, 16.7% 60 to 69, and 26.7% 70 to 79. The death that we did get reported and shows up in our numbers today was an individual in their early 90s. And so that went into the over 80 age group. There were some fairly serious underlying health conditions, cardiovascular, lung, diabetes kinds of issues going on with this particular individual as well. Deaths by sex are 50% female, 50% male. When we look at deaths by race, we're 63.3% Caucasian, 33.3% African American, and 3.3% unknown. By ethnicity, 86.2% not Hispanic or Latino, 6.9% Hispanic or Latino, and 6.9% unknown. And that is our data for today.
At this time, we will open it up for questions. If you have a question for Ingham County Health Officer Linda Vail, please raise your hand or just chime in. Go ahead, Craig.
Linda, what information do you have on the number of cases that have been reported over at Holmes Hall at the MSU campus?
We are in communication with MSU about that. My understanding is there's not an outbreak in MSU Holmes. So basically working with MSU and cases there, I don't have a lot of other information, but we don't have a significant outbreak at Holmes that I'm aware of. And I think Amanda just checked the case numbers over there as well. So.
You know, at what point did MSU notify the health department of the cases that they found at Holmes?
There are cases at MSU. I don't know that they're all at Holmes. So that is part of the story that's not necessarily accurate. We were notified, actually, I talked to the university physician over the weekend, and some of those cases were notified over the weekend, as well as, I think yesterday, we got a notification of confirmed positive. They've been testing athletes as well as coaches and training staff and other individuals there. So we have ongoing communication with MSU. So all of that has been known as it's been going on. Not to mention the fact that as soon as a test result comes out positive, it is immediately in the Michigan disease surveillance system. So we know it on that side, whether we hear from them or not. But it does help us connect the dots.
Thank you.
Thank you. I have a question from Sarah Lear in the chat. It's regarding vaccines. Some of your answer, we might have to get data for you, Sarah, but it says, non-COVID question, have you noticed a drop in Ingham County childhood vaccination rates during the pandemic? Are parents seeking vaccine waivers still required to do so via an appointment at the local health department? Does that have to be in person?
So I haven't looked at our vaccination rates recently. The state puts out a vaccine report card. So keep in mind that, you know, vaccinations are on a fairly, you know, lengthy schedule. And, you know, infants, of course, are going into pediatricians' offices for well baby checks fairly regularly. And a lot of that immunization happens in those provider offices, pediatrician offices. So I would expect that there hasn't been a lot that's changed, except for, you know, when we were early on in this and perhaps not having as many basically non-essential medical visits. But, you know, you'd have to talk to a pediatrician. I would imagine those well baby checks for infants are probably considered essential. We still operated in our Cedar Pediatrics clinic throughout. Parents will still have to seek waivers or have a consultation with the health department in order to get a waiver for anything that's non-medical. So the medical waivers do come directly from the provider. Very small percent of our waivers are medical, though. They're generally philosophical or other, and those will still require that counseling appointment because it's written right into the rules. But we do have the ability to do telehealth visits, so we can do those in that way if that's going to work best for both the parents as well as our team. So.
Go ahead, Brian.
Yeah, Brian Tyler, Home TV. You mentioned earlier in your presentation that Meridian Township has a high rate of COVID cases. Can you tell me what the residents of Meridian Township can do besides wearing a face mask and social distance to lower those numbers of cases?
Well, some of those cases are coming out of a long-term care facility there. So there's that hot spot at Ingham Medical that's part of the issue and has been, you know, an ongoing issue, although it's not a really huge outbreak relative to what we've seen in some other nursing homes. So what can people do? Wear face masks, social distance, stay home when they're sick, all of those sorts of things. Seek out testing. Testing isn't going to prevent you from getting ill, but, you know, it does help you to know what's going on. It does help you sometimes to not spread it to other individuals. So to the extent that, folks are out there in maybe more crowded housing like we saw in 48911, that's something to be aware of, and to kind of, offer some education, offer some testing services, things like that. So I believe Debbie Edipolo, who works for our department, is going to be working with some folks in Meridian Township to see if there are any special needs kind of things that we can do to meet with them and get some things addressed. But I don't know of anything particular other than the general scheme that we have for pretty much everybody.
Yeah, okay, thank you.
Mm-hmm.
Go ahead, Craig.
Yeah, so just to clarify whether Linda or Amanda, so what is the number tied to Holmes Hall? I know with the outbreak standard, it's cases above 2 or 3 positives tied to a particular location. So what is that number for the dormitory there?
We're not sharing a specific number of cases within Holmes Hall, and the outbreak standard is 2 or more cases with a link or a connection. Yeah.
So, Holmes Hall, I'm not that familiar with it in terms of how big it is, but 2 cases wouldn't necessarily always mean an outbreak. You have to connect the cases. There has to be a common source. And, in a dormitory with people on one side of it and people on different floors, there may or may not be a common source within a dormitory to be called an outbreak. So we have to be able to connect the cases together.
Okay. Just as another question, I know during the governor's press conference this afternoon, Dr. Caldoun was talking about how they'd broken down some of the other outbreaks statewide, whether it's tied to nursing homes, social gatherings, workplaces. Do you have a sense of what that looks like here in Ingham County?
Say that again. I'm sorry.
Oh, so today at the governor's press conference, they talked about the percentages of outbreaks being tied to particular places or activities, whether nursing homes, social gatherings, or workplaces.
Mm-hmm.
Do you have a sense of what that looks like, how that breaks down here in Ingham County?
Wow. Well, we have about 190 cases tied to the Harper's outbreak alone. We have another 21 or so associated with a vet clinic, and then some nursing homes. I'm going to say 25% or more. I'd have to look at the numbers, honestly, to tell you. I'm just trying to guess just based on numbers I have in my head related to outbreaks, and knowing our total at about 1,370. So let me do some math on that and answer that question instead of just guessing, because I'm just trying to pull a whole bunch of numbers into my head at one time and do some fast math.
Okay, I'll follow up with Amanda on that.
Yeah, that'd be good.
Thank you. And then we did have a recommendation related to travel about a week or so ago, and about 1/3 of the cases we found were connected to travel.
Right.
Rachel Sweet, you're next.
Hello there. Question connected to the MSU at Holmes Hall. How are you guys handling contact tracing? And that doesn't have to specifically be Holmes Hall, but even with the MSU athletes.
So contact tracing is basically mostly our responsibility, although we are working with MSU to see, and basically, we're looking at thousands of students coming back. So these athletes are a very small number compared to what we're looking for. So we are working with the MSU University Physician's Office so that they can do some of the contact tracing. So as soon as though it becomes basically somebody in the community or off campus, they're a little less intertwined with that, and that's more likely to be with us. So when, say, a student may test positive or something like that, and there are other students around that they're connected to, that's going to be different than, I went and visited my best friend's family, and so I exposed all of them too. And so that contact tracing will depend on, again, where is the person, what health department needs to be at hold of them because they're residents of a different county perhaps, those sorts of things. So remember that cases belong to the health department of residence of the individual, and as does the contact tracing in the case investigation.
And if
Always.
if the outbreak, if it becomes an outbreak, would you have to shut down Holmes Hall or?
It would that's hard to tell right now. I mean, it would have to get pretty substantial, for that to happen. I mean, the university anticipates having quarantine and isolation going on in dormitories on campus. So they're already preparing to put people into different places and keep them either isolated or quarantined as needed. And so, they're kind of, working that path right now as well, with these individuals. So.
Okay, and then one more.
Okay.
Will the county handle tracking testing in public schools? And if so, will those results be public?
Well, everything's public to the extent that it needs to be a public notice. So, public notification is always important if there's a reason for public notification. We don't encourage, a case or something like that being some sort of a broad public notification. Yes, we do all the contact tracing. Now, like I said, we've got volunteers that help us. We've got a variety of folks that have been working on contact tracing, which is why MSU would do some of theirs. They would not do that without our involvement or oversight. And that would be the case with schools too. If we have volunteers or other contact tracers working with us, it's still part of one big system that has to be connected and linked together so that everybody's on the same page and knows what's going on. And so we can connect those dots and identify outbreaks as we need to. I mean, until you put a couple of cases together and find out that there's a common source, you don't even know that an outbreak is going on. So, getting that information in and connecting it together, especially if different people are doing contact tracing, it all has to come back and it all has to get evaluated constantly by our team, as well as just making sure that everybody's doing contact tracing and case investigation the same way. And then handling basically recommendations around isolation and quarantine and all of those things the same way.
Thank you.
Mm-hmm.
Does anyone else have a question?
If no one else does, I have another.
Go ahead.
So as of yesterday, you guys didn't indicate that there was an outbreak in the auto plants, but confirmed there have been cases. Will auto plants close if they reach a certain number of cases? Do you know?
Not necessarily. I mean, let's look back at what happened at Herbrooks, right? We had all those cases out at Herbrooks Poultry Farm. We also had a number of cases at Meyer Warehouse. Neither of those facilities closed completely. They're very large employers, very large facilities. In the case of Meyer Warehouse, like literally multiple buildings. And so the closing of a building or anything like that is, again, going to depend on the exposure. And again, a GM plant is very large. And so you could have two cases there that have zero connection to each other, depending on whether they're coworkers, whether they were ever in the same place, whether they know each other at all those sorts of things. So you have to evaluate all of that in order to say it's an outbreak. And then, like I said, we can keep, the contact tracing going on, the isolation quarantine going on for quite a while and keep it in control. And then, the need for closure is just something that you have to evaluate as you go. It's really hard to say right now, would you close the GM plant? We didn't close Meyer Warehouse and we didn't close Herbrooks. And those were some fairly significant numbers going on there. And both of those outbreaks were ultimately controlled. And we, made our way through them without significant disruption in their ability to continue to do the business that they do.
Okay. And if there's no other, I do have one more. Last one.
Okay.
I know you guys said that you weren't going to say the numbers on the Holmes Hall, but is there a specific number that you have for the MSU students, athletes? I know that yesterday there was 16 that tested positive for COVID. Do we know a number?
I don't have a current number, no.
Okay.